Continuing on the issue of risk assessment, and you can have two ways to look at risk assessment. The one, as we've just described, is should you do it or not do it? But there's another factor that comes into play, and that is if you cannot make a do or don't do decision. So sometimes it isn't easy to know before you even start a procurement whether you should do it or not. You basically have to do the procurement and make a decision after you've done it. But sometimes and not just sometimes, what you specifically should do for some type of procurements more than others is focus on provisions that let you gauge effectiveness. And for some activities that might be very simple. If you're cleaning a floor, is the floor clean? Is it free of lint? Is it free of this? Is it not stained and things of that nature? For other things, and we'll start with those things at the top. If your assignment is to get a vendor to do an advertising campaign, okay, if you get a vendor and the vendor costs $100,000 and you spend $100,000 for the vendor and you spend a couple $100,000 to place advertisements on radio and television, etc., what's the result of that? Was it worth doing? Did it have a positive effect? And maybe you can say that it did, and maybe you can't say that it did. But there's things that you can do to try to structure it to try to make sure that there is some kind of evaluation. You do some kind of baseline. You have information before you did the PR campaign. You make sure the solicitation has a requirement that the vendor go out and do focus groups or do surveys or something that finds out, were they impacted by that advertising campaign? Because if you don't do that, you don't know whether you had money well spent or money that just went down the drain with nothing to show for it. If you have a drug treatment program and you spend lots of money to try to make sure people don't go back and abuse drugs, is it effective? The only way you know it's effective is if you know without treatment how many people would stay on drugs, with a certain type of treatment, how many people go back and use drugs versus how many people stay off. So if you have a different type of treatment modality, is that going to give you better results than the other treatment modalities? And to find that out, you have to have statistics. You have to have provision in the contract for how a vendor is going to measure whether people went back on drugs after a certain period of time, 3 months later, 6 months later, etc. Otherwise, you're not going to know whether the money you spent was worthwhile. If you have programs for juvenile services that are designed to keep kids from graduating into the adult crime environment and going to prison, etc., are they effective? Do they keep kids from graduating and doing worse crimes and going to jail? And if you don't have some kind of measuring system, you're not going to know. So you can take one decision is if you can't prove in advance it's going to work, you don't do it. But for these types of things, that may not be an effective decision. To just say, nope, since we don't know if it's going to work, we won't undertake anything, because nothing ventured, nothing gained. So maybe you have to do your procurement, build in as much as you can how you're going to do an assessment of effectiveness, and then based upon that assessment, make decisions after you make the award. And so you have to do these things in planning stage. Yes?
Other than lowest price, because a lot of times when we do big procurements, we don't
Yeah,
know.
for these type of things, price usually, and these types of things are usually done by sealed proposal, because price is not necessarily going to indicate to you whether something's going to work. What you're looking for is a change in some kind of outcome or some kind of performance. If it's advertising, let's say the advertising, and I think I have this in a couple of slides, let's say we want to increase ridership on buses. And so the focus of a PR campaign is to get more people to ride the MTA. So to do that, the first thing obviously is you have to have your ridership currently, which they know. They know how many people ride on the buses. And then let's say you have a 2-month intensive campaign, radio, television, that says how wonderful it is to ride the MTA. And then you simply look and see, is the ridership up? And they're going to know that without any external evidence. They're going to know whether the ridership is up. But now the key point is, is the ridership up because of the PR campaign? You can make that conclusion. If it was at this level without the campaign, is at this level with the campaign caused it to be at that level. And maybe that's a correct analysis, and maybe it isn't. Maybe the trend was going up anyway, and there's no difference in the upward trend of ridership between doing the PR campaign and not doing the PR campaign. Maybe, in fact, there's a trend upward that actually the increase is lower than the previous trend was with the campaign. So you do that, and probably what you're going to do is what you suggested in something like that. You're going to specify in the solicitation, and probably you won't specify this, probably you're going to say to the vendor in their proposal, you tell me how you're going to gauge the effectiveness of your own advertising campaign. You explain to me the procedures, the activities you're going to undertake that's going to evidence whether what you do worked. And what you would hope they would come back with is, okay, we have a scientific procedure to go out and let's say we're going to select 20 different focus groups of 10 people each. And we're going to go and we're going to take people that, we're going to, let's say, have 5 groups that are composed of people that ride the bus frequently. And we're going to have maybe 5 groups of people that we have surveyed and they don't ride the bus at all. And so, number 1, we'll ask people, have you seen the ad? Number 2, what is your opinion if you've seen the ad? Do you like it? Do you not like it? Number 3, did it influence your action, your decision to ride, not ride, etc.? So probably you would have them explain all this and just see whether it seems to make sense, see whether what they have structured seems to indicate whether there was an effectiveness. If they say they're going to ask these questions, did this influence your decision to ride? First of all, did you ride? If you didn't ride, could this PR campaign have changed your mind one way or the other? And you're probably going to use just anecdotal evidence like that to make a decision as to whether you should do this again or whether you should exercise a renewal option. I mean, this is very difficult for any campaign. For instance, there have been times when you've had car ads where they barely ever show the car. And they're just trying to give you some kind of, I don't know, some kind of overall perception of wonderfulness. And they simply mention the name at the end or something like that. So was that effective? Did they get people to buy more of the particular car? And that's what people in this business do all the time, try to gauge whether something was effective. Sometimes they can pinpoint it exactly. If you're doing, for instance, tourism, if there's ads for tourism and there's ads appearing in Pennsylvania papers or radio stations in New Jersey and things like that, and they say, call this number for more information about Maryland, or send an email to this address and use this code. Well, the code will tell exactly where that call originated from, supposedly what market an ad was, advertising was placed in, and you can gauge the effectiveness of it by doing things like that. But sometimes you'll specify, sometimes you'll have the vendor specify, but you should focus on how do you evaluate. And generally, I guess my basic premise is the vendors should be able to tell you how to do it. If you simply require them to give you the information, make sure that's part of the specifications, make sure that's part of the proposal. Tell me how you're going to evaluate the effectiveness, what you're going to do, why you chose or are recommending that you do it this particular way, and then how will you gauge the effectiveness of it. And they basically have to convince you that they're going to do a good job of doing this, and the vendor that convinces you that they're going to do the best job, that has a reasonable price, you're going to award to them. And then you follow through and make sure they do it. And then you make a decision. Did it seem to have the correct result? And that's the difficulty. How do you do it? But one thing you shouldn't do is just say, I don't know, so, well, we'll just hope it's going to work. You make them do it. This is the kind of thing that's tailor-made for an evaluated procurement with the responsibility on the vendor. And let's see, advertising, juvenile services, etc. Some of this will seem very pertinent here. Advertising campaigns to cut smoking. to stop teen pregnancy, to help with business or industry, to help attract tourists, to increase ridership on mass transit? Do they work? Are they worth the money? That's the key question that needs to be asked. It's difficult to determine, what we just said. We may have to award the contract to find out. However, means should be specified. It's going to be in the contract that require the contract to evaluate its own effectiveness, or the one thing is you tell me how you're going to do it. The other thing that you can structure is you can have your own staff do an evaluation through some mechanism. You could have another vendor do the evaluation, because there's always a little bit of perhaps skepticism if a vendor is evaluating its own effectiveness. Now, maybe they can give you a procedure that will have safeguards that you can believe the answers they give you. But sometimes the best answer is you don't have that vendor evaluate its own effectiveness. You have some other organization, contractor, entity evaluate the effectiveness. But you would write that in the specifications, that vendor, you're going to do this, and quarterly, semi-annually, annually, whatever the situation is, we will have an organization that will come in and do focus groups, or we'll send surveys, or we'll do telephone automated dialing and see if we can ask questions of people answering the phone, things like that, to get an indication of effectiveness. You have some mechanism, the best that you can work out. So no fail-safe system, no magic answer, but you do things that you think were going to be effective, and then after you specify them, after you have them implemented, you make a judgment. Did they seem to work? If they, yes, we're going to keep doing it. And maybe there's something else you learn along the way that you will implement that as well. Or if it doesn't seem to work, then you'd stop doing it and try something else. So that's what I'm saying. These are things that are hard to gauge. So whereas we say you should do this analysis, how do you analyze something that is inherently hard to analyze with difficulty? There's a little joke there. So let's see, moving on. For instance, there should be before and after statistics of smokers. How many people smoked before the advertising campaign? How many people smoked after the advertising campaign? If you have this automated dialing, have you seen this advertisement? How many people say they have seen it? If they've seen it, did it influence you? Are you more likely to stop smoking after having seen this? Things of that nature. If they have a call-in number, it's very easy to find out how many people called the call-in number if the only place they get that number is from the advertising. So these are things that you can do. And that's part of the difficulty of writing the specifications, to figure out what you should do. But you need to do it for these type of activities. Teen pregnancy, what's going to stop people from having sex, getting pregnant? When they're not married, when they're underage, and they're going to have to drop out of school and things of that nature, there are things that have some indication of effectiveness, but none of them are surefire activities that are going to influence this. Tourists, I think tourists are relatively easy, I think, because they have the call-in numbers, they have the email addresses, they know how many people respond. The hotels know how many people are filling up the rooms, and they know where they're coming from, because when you sign in from Pennsylvania, Ohio, Michigan, wherever, so you can have that information. And in fact, that's pretty much what is used to do the advertising. You find out where people are coming from, and then you tend to do more advertising where people are already tend to come into Maryland. So it's a lot of things interrelated. Mass transit, again, you do the survey of, did you ride it? Are you more likely to ride it? Things of that nature. From these statistics, we can get an indication if the desirable factors increased and the undesirable ones decreased. However, even if there has been a change in the right direction, it also should be ascertained if the advertising caused the change. Just because you had an ad doesn't mean that anything that happened that was positive was because of the ad. It might have happened anyway. And it even could be that the ad turned people off and there would have been more without the ad. That's kind of extreme, but it's possible. And if you don't do some kind of surveying, you won't know. So you build it in, have the vendors build it in, etc. Or maybe it did, but when you compare the positive result versus the cost of doing it, it just didn't make sense to continue it. Same general issue applies to drug treatments, prevent recidivism, etc., etc., etc. For any of these contract types, make the most informed assessment that reasonably can be made before doing a contract the first time. Have real data on effectiveness before doing additional contracts or exercising options or doing task orders or whatever. Can you offer any examples when you applied these principles or learned that you should have? So anybody that wants to offer anything along these lines? Okay, moving on. Another little exercise. And some of you, well, probably no one here exactly has experience with this, but we'll see. MA is medical assistance. So there are a few people here that at least know what medical assistance is, right?
Right.
At least one, right?
No, Elisa's here, she's the chief.
We got two. All right. Different type of risk assessment example. Almost 20 years ago at DHMH. And where are we today? DHMH, okay. That was a trick question. I wanted to see if you could answer that. It was another one of these instances of, at that time, a $400 million state deficit, and the first time I ever experienced state furloughs, around 1990, I think it was, which is 20 years ago. So I remember being furloughed for, I think, 4 days at that time. And that's also, we went from a 35-hour work week to a 40-hour work week. Some of you remember when there was a 35-hour work week. The medical assistance program had to cut expenditures. Since when doesn't the medical assistance program have to cut expenditures? They decided that one way to cut costs was to reduce the expenses of transporting MA recipients to doctors, hospitals, clinics, etc. for outpatient treatment. So the first thing the medical assistance program did was to change regulations, because up to that point in time, transportation was an entitlement. And some of you will probably tell me more about this than I'm telling you. And an entitlement cannot be restricted. The clients are entitled to whatever they're entitled to do as an entitlement, but if you change it from being an entitlement to an administrative expense, then there can be restrictions on the client's access to things that are administrative in nature. Does that sound right? Okay, so far so good. So they got the regulations changed from an entitlement to an administrative expense so they could manage it. At that time, and this may sound trivial at this time, I don't know, but at that time they were spending $12 million a year on transportation. Today, I guess that might be somewhere in the neighborhood of $15 to $20 million, maybe even more, for just getting people to the doctors and hospitals. The current system, the system at that time, was judged to be inefficient. There was no coordination. Any MA recipient could call any transportation provider, taxi cab, anybody that had, that was an MA provider, and say, come pick me up at my house at this time and take me to this location by that time. And the vendor would do it, and they'd send the bill to medical assistance because it was an entitlement. And MA would pay. Transportation, so we said it was included in regulation, recipient right. So the example is if you had someone from Cumberland that wanted to go to the University of Maryland Hospital, could say, pick me up at 7 o'clock, and someone else from Cumberland could go to the same hospital a half hour later with a different taxi company, and the whole freight's paid for each individual. Because there was no way that MA could say, no, both of you have to get together and go on the same trip in the same vehicle, etc. And each recipient would then get a separate cab for the separate trip, and each trip would be billed to medical assistance and paid. MA officials thought they could save about 1/3 of the then cost of the transportation, so about $4 million a year, if they could coordinate trips. And the first thing they did, as we said, was get it changed from an entitlement to an administrative expense, and that would allow them to have the right to do restrictions and coordination. All right, then they held several internal agency meetings to discuss ways to develop competitive specifications to obtain a vendor to provide coordinated transportation services. The idea was to pay one vendor at the established reimbursement rate for all transportation services deemed necessary. So we're going to get a vendor that's going to do this for us. They're going to be the one responsible for all these transportation trips, and because they're going to do coordination and they're going to have this whole pot to do things with, they should be able to do it more efficiently, they should be able to cut costs, and the concept that we have now is we're going to offer them, because this was what was being kicked around, we're going to offer the contract a percentage of savings of the cost avoidance. So it's $12 million now. If they can whittle that $12 million down to something below $12 million, we'll pay them as an incentive for the cost they did not incur. Sounds like a good concept, right? If you avoid $1, we'll pay you $0.25 for avoiding $1. And that is a valid concept. It is a good principle. It's something that we should try to use more often, incentivizing vendors to do work. And we have examples later in this class about incentives. So that was the concept. The concept sounded promising. So your assignment for the same groups that you had before, and we'll give you 10 minutes or so, 15 at the outside. Determine if it is feasible to contract out the provisions of transportation services to MA recipients in such a way as to substantially reduce the cost of transportation without severely restricting recipient access to medical care. If a procurement is feasible, how should it be priced to assure the expected cost savings? So if you would take 15 minutes, work in the groups you had before, and figure out from what we have given you, and I can't give you any more information because that was the assignment. That is the information we had. Now let me go back and try to summarize. This is the thought process that we had 20 years ago. So let me see. If you're the single vendor, you get paid for what you do. You get paid for each trip that is made. Okay? You also get a percentage of what you don't do, the cost avoidance as an incentive. That was the premise. But our problem at that time was we couldn't figure out a way to determine what would the cost have been without the contractor. i.e., did they stop something from happening that would have happened anyway? Did they do it arbitrarily? And we were trying to figure out how can we make this a safeguard to make sure that we could figure out what they avoided. And there probably were some ways we could come up with this, but we couldn't figure out a fail-safe way to come up with what they avoided. We looked at historical data, but historical data may not be relevant because obviously 2 years ago there were a whole lot fewer people on medical assistance than there are today. I mean, today is what, around 600,000? 690,000, and 2 or 3 years ago was 400? All right, so you've had at least 200,000 person increase. All right, 30% increase, so there's going to be more trips. So if there are more trips now than there were before, and those trips are solely attributable, perhaps solely attributable to more enrollment, now maybe you can figure out something per enrollee, or maybe that's another complication. More MA recipients mean more transportation costs, fewer recipients means lower costs. So what we came up with at that time, and I'm not saying that we came up with the perfect answer, but at that time what we said was, or our conclusion was, the contractor could be inefficient and make incentive money simply because the enrollment numbers went down, hence there's fewer trips. Or could be very efficient and still the cost of transportation went up because there were more people on the rolls, or the people that were on the MA rolls needed more transportation than the people previously. So it did not necessarily mean the contractor was or was not being efficient solely based upon the expenses. We figured we would have to audit this extensively to try to figure out whether anything was justified or not justified from an incentive standpoint. So a huge expensive audit situation would be involved because of trying to find out were they entitled to an incentive. There would be pressure on the contractor, as some of you have already said, to deny services even when justified in order to earn incentive payment. How am I going to make my money? I'm going to make my money by not serving the incentive money. To not be efficient, now here's another issue. There would be pressure on the contractor, number one, to deny services and get incentives, but number two, to not be efficient and end up being reimbursed the entire amount of the payment for services. If we're paying $12 million and we give you, let's say, a 10% incentive if you are less than $12 million, well, maybe you'd rather make the $12 million than the 10% of what you didn't do. I mean, that may not be perfect logic, but that's the kind of thing we were thinking. That if a vendor simply continued what was going on now, they were going to make more money potentially than if they tried to be efficient. And in other words, there was a counter incentive for the contractor, and what you never want to do consciously is set up a situation so the interest of the contractor is at odds with the interest that you want the contract to perform. Because that means you really have to be looking over the contractor's shoulder to make sure they're not following their own interest versus your interest. You want to make sure that those interests coincide so that they want to do what you want them to do. That's how they get more money. And there was concern because one firm, and this is another little extra added attraction to this, there was a particular firm that had already hired a lobbyist who was visiting medical assistants and the hierarchy of the health department to try to get this procurement to happen. And what did that mean? That meant this vendor was ready, willing, and waiting to get this contract because they thought it was big bucks. And they wanted to make those big bucks. So we were very concerned that this vendor was so anxious to get this contract that they were hiring lobbyists to try to have this thing put out to bid.
You might have done a good job.
The lobbyist or the vendor?
The vendor.
The vendor might have.
You know, one of the things Sam Rittenhouse, who was the manager of electrical engineering at BG&E, one of the things he used to do is you'd walk up to him and say, we're going to put in a substation. And he'd say, what's the MVA rating of the substation? And he had $1 per MVA, and he'd tell you the bucks of that substation right off the bat. I think if you sat down and figured out the cost per, say, 1,000 MA clients, or 10,000 if you had 600,000, you'd have a number that as the number of clients went up and down, you'd be able to measure, not exactly obviously, but pretty closely, increases of population and decreases, and could tie that in to the vendors.
Right. We probably could have figured out some mechanism to account for increases and decreases in enrollment, things of that nature. So, excuse me. Yes, and then we just have to go on and finish this. Pardon me?
I would have hired a vendor to look at other states that are geographically similar and have a similar number of Medicaid recipients and see how they were doing.
You always want to know what are other people doing and do some kind of comparison of that nature. All right, so let's just continue here. So just continuing on the theme of what we did at that time. At that time, many vendors got paid directly for providing transportation services. Under the proposed contract, the winning vendor would provide all transportation services either directly or with a network of subcontractors, really with the expectation of the network of subcontractors. If this vendor was not efficient, it would receive $12 million or more. If it was efficient, it would receive less than $12 million. Under the best case scenario we came up with, we believe that a conscientious, efficient vendor could save money. So we said definitely there is the potential that if you have the right vendor who's doing a good job, conscientious, etc., we likely can save money. But the same thing we came up with if you did not get this good, conscientious, efficient vendor, and looking at it from the worst case scenario, you could end up paying more money than under the current system, having a flood of service denial complaints, having an audit nightmare, or having the contractor default and have no other procedure to go to. So we looked at the whole gamut of alternatives. And we said, yep, it might work, but on the other hand, it might not work. And the old premise of how would it read in the headlines of the Sun paper?
That's unimportant.
And that is very important. And under even the possibility of the second scenario, that we could end up going out for something to save money and end up paying more money than saving money. And doing it with one vendor versus dozens or hundreds that were currently enjoying the services did not seem like a very good alternative. So in the end, it was decided not to do it. Don't even try it. What happened instead, and some of you can relate, and this goes to what Gary said, what they did instead was to go to each of the 24 jurisdictions and ask them, under this alternative to procurement, they went to the 24 jurisdictions and asked them to take on this responsibility. And in most instances, the local health department is the one that agreed to take on the responsibility to do this coordinating, etc. In some locations, it was other than the local health department, but in each jurisdiction, they agreed to do this for their citizens within their county or the city. The local jurisdictions knew their citizens and their communities. They had no reason to deny needed services. They were told that any savings that they would that happened would help ensure the continuation of benefits for MA recipients in their jurisdiction, their county, or the city. In contrast, any cuts in MA benefits would likely result in higher costs to the localities because the local health departments are the providers of last resort and people would go there and they contribute to the local health departments. So there's a reason to keep them away from the local health departments. It saves them money as well. MA paid for a certain number of employees to be hired in each jurisdiction to do the approving and coordination. The jurisdictions were held harmless for actual costs because some of them didn't want to just take the risk that they would incur costs beyond what MA was paying them. So MA said, we'll approve what you do, and if you can prove to us you need more, we guarantee we'll pay you whatever your costs are that are reasonably necessary. So they got paid for what they actually approved, typically through subcontractors. The result was efficient services at lower cost than when transportation was an entitlement, maybe not as low as it could have been under a vendor through a competitive process, but maybe it was lower, and you'll never know because we never did the procurement. That was decided to be a better alternative, given all the other situations, than what the initial premise was. So it just shows you what is the problem to be solved. The problem to be solved is lowering transportation costs. Do you do a procurement to solve that? You look at all the ramifications, all the alternatives, and sometimes the answer is no, you don't do a procurement. Now, if they'd have gone to the 24 jurisdictions and most of them would have said, nope, not going to do it, then we'd have had to look again at the procurement aspect. But they didn't say that, so no procurement. And with that, tomorrow we will get into cost-benefit analysis.